Hello, I'm Ray Strobel, a fourth-year medical student applying to integrated and 4+3 cardiothoracic surgery residency programs this fall. Today, I'll be briefing you on your second ask for this fly-in. This topic involves several components. 1. The Medicare Access and CHIP Reauthorization Act, also known as MACRA. 2. A long-held goal of the STS to access Medicare claims data. And 3. A Congressional Price Transparency Initiative. Your ask to Congress is to please urge Centers for Medicare and Medicaid Services, also known as CMS, to improve price transparency and lower healthcare costs by properly implementing Section 105B of MACRA. A background on this ask. When the Medicare Access and CHIP Reauthorization Act passed in 2015, it contained a small provision that was supposed to allow qualified clinical data registries, like the STS's national database, to have access to Medicare claims data. This was something the Society had been fighting for years to achieve. Unfortunately, and as you may know, the Society has yet to receive this access to Medicare claims data. While you are familiar with our Society's database, your elected representatives and their staff will likely need you to explain the database and its power to drive quality in healthcare. Your explanation of the STS Adult Cardiac Surgery database will help them understand why and how properly implementing Section 105B of MACRA will be beneficial to patients. As you know, the STS National Database, currently approved by CMS as a Qualified Clinical Data Registry, also known as a QCDR, was established in 1989 as an initiative for quality assessment, improvement, and patient safety among cardiothoracic surgeons. The fundamental principle underlying the STS National Database Initiative has been that surgeon engagement in the process of collecting information on every case, combined with robust risk assessment based on pooled national data and feedback of that data to individual practices and institutions, will improve the practice of cardiothoracic surgery for the benefit of patients. Indeed, published studies indicate that quality of care has improved as a result of the STS National Database, and that the database has fostered cost savings by helping cardiothoracic surgeons find the most effective treatments. However, absent access to claims data or other information on patient outcomes, the database is limited to clinical data, and only those data captured while a patient is under the care of a participating STS member. With access to Medicare claims data, our analyses would grow to capture longer-term patient outcomes and would also be able to demonstrate value. Here we define value as quality over cost, rather than just quality in healthcare. Despite statutory language directing them to do otherwise, when CMS began the work of implementing MACRA, they determined that it was not necessary to make any changes to the way QCDRs access Medicare claims data. The agency claimed that the CMS Research Data Assistance Center, also known as RESDAC, was already providing that service. Through advocacy from STS members just like you, we were able to get CMS to reconsider its position. In a subsequent rule, CMS made changes to a policy known as the Qualified Entity Program that was intended to expand access to claims data to QCDRs like the STS. By creating a quasi-QE option, CMS again determined its job was done. Unfortunately, that pathway is also very difficult to navigate. Although STS database leaders are still trying to navigate the quasi-QE program requirements, it has proven cumbersome and insufficient in terms of the statutory requirement from MACRA. As you can see from this chart, there are a number of problems with both the options being offered by CMS. On the left RESDAC side of the chart, you will see that RESDAC data are designated to be used for research purposes only. That means that STS National Database staples like physician feedback and public reporting ostensibly would not be allowed. Further, other organizations that have sought data from RESDAC for these purposes paid large sums of money and still had to wait more than a year for their data requests to be filled. Perhaps the biggest issue with RESDAC data is that it has a time limit for its use. After 3 or so years, RESDAC insists that all Medicare data must be returned to them, rendering any follow-on analyses impossible. Under the right quasi-QE program, in addition to the burdensome application process, the data must be used exclusively for quality improvement. This means that if, as part of the Society's quality improvement efforts, we identify something in the data that would be worth researching, STS would have to apply separately to ResDAC and purchase the same data a second time. Unfortunately, with so much going on in politics around healthcare policy, it was hard to find buy-in for such a seemingly minor issue. That is, until members of Congress began talking about the concept of price transparency in healthcare. The idea is that consumers, known in some circles as patients, should have the ability to determine what their care will cost. That way they can be educated consumers of healthcare and make better decisions about what care they can afford and where they should get the care that they need. Economists would suggest that having an educated consumer population will drive competition and lower costs. Fortunately, we've been asking Congress about price or cost transparency for some time. To bring this all together, if the STS national database could be augmented with Medicare claims data, we could facilitate value transparency, where value is defined as quality over cost, which goes above and beyond price transparency. We could continue to improve quality and patient outcomes. We could create alternative payment models and define episodes of care, and facilitate patient-centered comparative effectiveness research. Finally, here's the message we hope you will bring to Capitol Hill. Because there are different initiatives going on in both the House and the Senate, the asks are slightly different depending on who you are meeting with. When you meet with your representatives, your ask is this: ask your member of Congress to sign on to a letter from Congress to CMS, which asks for implementation of Section 105B of MACRA that is consistent with congressional intent and that will provide better price and value transparency in healthcare. Conversely, when you meet with your senators, you can educate them on this issue, as well as educate their staff on this issue, and then ask them to keep tabs on the bipartisan collaboration being led by Senator Cassidy and Senator Bennett on the topic of price transparency. Thanks for listening, and I hope you enjoy your visits on the Hill.